With that, I'd like to call the Health and Human Services Committee hearing to order. Madam Clerk, would you please call the roll?
Alderwoman Ingracia.
Present.
Alderwoman Tyus. Alderwoman Green.
Present.
Alderwoman Martin. Alderwoman Navarro.
Present.
Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Spencer.
Present.
7 present, you have quorum.
Thank you. And with that, I'd like to excuse Alderwoman Martin for an excused expected absence. Okay, I'll entertain a motion on the approval of the minutes from Thursday, October 29th.
So moved. Second.
Madam Clerk, would you please call the roll?
Alderwoman.
Aye.
Alderwoman Tyus. Alderwoman Green.
Aye.
Alderwoman Martin. Alderwoman Navarro.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Spencer.
Aye.
7 aye votes.
Thank you, Madam Clerk. With that, we have two major issues to discuss before the Health and Human Services Committee today. The first of which is a bill that I would like to give a significant amount of credit to the Health Department and Janine Arigi for preparing. It is to update our code related to food and National Food Code for the city of St. Louis. And with that, I'd like to get this bill moving forward so that we can proceed with having it before the full board before the end of the calendar year. So Janine, do you think we could handle this fairly quickly, or I should have maybe perhaps I'd like to have you give an introduction to this bill, and if you think we can move it fairly quickly before at the front end of this meeting, I think that would be best.
Yes, I think we can do that quickly.
Okay, with that, Janine, can you give us kind of a summary of Board Bill 207?
Sure. It's been more than 10 years since we last adopted the food code. The FDA code has been revised 2 times since then. So it's time for us to take advantage of the fact that the Food and Drug Administration do the scientific research and background to make sure that our food code is current with the current science in the field. So we're happy that we have the opportunity to adopt a new food code using the current FDA food code, which was published in 2017. The new publication is delayed a little bit, I think, by our COVID situation. The participants in working on the code revision included back last year a number of temporary food businesses and farmers markets when we revised the temporary food code, which we have incorporated into this code, and 2 food establishment inspectors on our team who have substantial experience in the food industry as managers in food establishments. One of our city councilors, our government services analyst, Craig Schmidt, our food supervisor, Patrick Nabian, and the coordinator of the effort was an intern, a practicum student from the Brown School, who's working on his master's in public health. He's a medical doctor. His name is William Effa. So this was a good experience for him. In general, what we've tried to do with this bill is incorporate the social justice and equity provisions that we included in the temporary food ordinance that was adopted last year, 71106. And we did make a small change so that persons who are operating in farmers markets without potentially hazardous foods would not be required to obtain a permit. That is, if they're selling whole fruits and vegetables that are uncut. That was a little ambiguous in the last code, and so I think we cleared that up. Another general change was we used to call out grocery stores separately because they weren't previously included in the FDA food code, but with this revision, the definition for a food establishment includes a grocery store. And then probably one of the major changes is we added an appendix to show the fee changes. We're proposing some fee increases. We actually have some fees that we removed, some penalty fees that we removed, but the fee increases because of the current COVID impact on food businesses, we are proposing not to increase until after July 1st of 2022. So just a few general points. We amended the definition of the regulatory authority to include our director as well as what has historically included the commissioner, and that's because we do not have a health commissioner at this point. Mm-hmm. Otherwise, the first 7 chapters pretty much pick up many of the requirements in the FDA food code. We have an additional chapter 8, which covers mobile food service. This didn't change substantially over the last code, except to eliminate some.
Mute.
I'm sorry.
Sounds like.
Is that me?
Janine, you do appear to be on here twice.
So I'm on here twice because I'm on a tablet to speak because our desktops don't have cameras, and so I could see the committee. I have I don't think that's because I think my computer is muted.
I think we're okay now, Janine. I think you can move forward.
Okay. So the mobile food service just was expanded a little bit to allow other kinds of foods. Before it was kind of limited to hot tamales and frankfurters. So it's been opened up for the wide variety of mobile food establishments that we do have operating in the city. Chapter 9 includes the temporary food permit bill that we talked about before. And then Chapter 10, our compliance and enforcement section, includes those changes to the fees that I mentioned before. One of the reasons for the increase in fees is because we evaluated what our costs are, and currently our fees are not actually meeting the costs of the program. And part of it is also because the FDA retail food standards indicate that we should have actually 27 food establishment inspectors. We have 8. So there's probably no way we would ever get to that number of 27, but with a little more revenue, we may be able to increase our workforce. The fees we compared to surrounding municipalities such as St. Charles County and the proposed bill for St. Louis County. So they're in keeping with those other local jurisdictions. And I think that kind of sums up what I have to present, and I'm happy to answer any questions.
Janine, and can you describe how this puts our fees aligned with St. Louis, the surrounding areas, St. Louis County? Yeah,
they're very, very comparable. Within $10, $15, the same, really close to the same amounts. And again, that's not going to happen until 2022. We would keep our current fee rates over the next year and a half.
Okay, and just for clarity, this incorporates all of the changes made with the temporary food permits last year, except that one little adjustment.
Correct.
Thank you so much, Janine, and thank you for your leadership. Thank you to the health department for helping to lead on this and update the codes. I'll now turn it over for questions from the board. Madam, let's see, Alderwoman Ingracia.
I don't have any questions, Janine. Thank you so much for your work on this. It's always really great to have the health department as a partner. You're very proactive in so much of the work you do. And I'd like to be added as a co-sponsor.
Thank you, Alderwoman. Alderwoman Tyus. Alderwoman Green.
Thank you. No questions, but I would also like to be added as a co-sponsor.
Alderwoman, thank you, Alderwoman. Alderwoman Martin is still not with us. Alderwoman Navarro.
Thank you, Madam Chairwoman, and thank you, Janine, for staying on top of this for us. I also appreciate your work on this. I just have two quick clarifying questions. So the food code, the food code has to do with food service, not nutrition guidelines. Is that right?
Correct.
Okay. And are there any other deviations from the FDA code that we should be aware of? It sounds like we mostly adopt their code, and then there's the temporary food permits. But was there anything else that we deviated from in terms of the FDA code?
Well, one thing is that we allow it allows political subdivisions, schools, charitable organizations to prepare or serve wild game, provided there's no charge. So, the other thing we added was a subparagraph that allows refilling food containers by establishments of the same company. This is to cut down on waste from disposable containers. So people could, if they're using the same food establishment over and over, could bring their containers back. They would be required to clean and sterilize those units for reuse. But other than that, there are not a lot of huge things. Added a splash guard where there's a potential for cross-contamination due to a splash from a hand washing sink onto a food prep area. And so those basic things.
Okay, well, those all sound great. Thank you again. And I appreciate the efforts to reduce waste for sure. So please add me as a co-sponsor, and I have no further questions. Thank you.
Thank you, Alderwoman. Alderwoman Rice.
I think Alderwoman Middlebrook is actually first.
Oh, I am so sorry. You're right. Thank you, Alderwoman Rice. Alderwoman Middlebrook. Got a little ahead of myself.
I have no questions, thank you, but I would like to be added as a co-sponsor.
Thank you, Alderwoman Middlebrook. Alderwoman Rice.
Thank you. And thank you, Janine, for the bill, for getting us up to. It's always nice when we have new city code bringing us up to the current decade here in St. Louis. So thank you so much for all of your work on this, and for continuing to incorporate the temporary food permits, because hopefully, even in such a weird year as 2020 was, we saw some success with those temporary permits. The one question I did have was on the low income, low access piece, as it's defined within, let's see, I'm looking at page 9 is where we really get into the Lila community temporary food permits. I remember when we presented the bill last year, there was a map attached to it that sort of defined that. I don't remember if the map itself was a part of the code or if that was just for our reference. And so a clarifying question of whether or not that map is something that needs to be included as an attachment to the bill, or if that was just an exhibit, if you happen to recall.
I believe it was just an exhibit. And I think the reason why we didn't include it here is because it is based on census data. And so we would be reevaluating it periodically.
Okay.
So the way it's defined, it says that the map would be made available through the health department. We would publish that on our website.
Great. Okay, awesome. That was the only question I had, and I would love to be added as a co-sponsor. Thank you.
Thank you, Alderwoman Rice. And I'd like to recognize your efforts last year in updating our temporary food permits, some efforts that were included, of course, in this bill. Alderman Todd.
Thank you, Madam Chair. And thank you, Janine. This is Janine. First of all, let me commend you for the good work you're doing, as well as getting rid of waste. If it's one thing in government and City Hall, let me be very, very specific. If it's one thing we need to do, is to be stewards of the taxpayers' money. That's what they elected us to do, and we need to use that money to benefit the citizens. And if we have some money left over, let's give it back to them. And the other thing is, that I would like to be added as a co-sponsor.
Thank you, Alderman. And I see that we have a couple of members of the Board of Aldermen who are not members of the committee. First of which is Alderwoman Pam Boyd, who has her hand raised. Alderwoman Boyd.
Thank you, Ms. Chair. I had a question, Janine, and I'm glad we're trying to catch up with the state food code. But the question, you said that some restaurants, and just clarify if I'm wrong, could bring back containers to put food in them. People could bring containers back to the establishments if it was a regular establishment, if they were regular customers.
Yes, I believe there are a number of food establishments in the area who have been working at this. Part of, I think, like the Green Dining Alliance. And so there are specific requirements in the code for how those containers would be cleaned and sterilized before they're reused. So it's not just any container, it would be a container that was provided by that food establishment or reused by that food establishment.
Okay, and so my other question is, how will the restaurants and or food trucks know of the updated regulations? How will that information be given to them? And since we do have such a shortage of inspectors, how are we ensuring that they're complying with their food code?
Well, we do send out a notification to the food establishments about 3 months in advance of their food permit being renewed. And so we would send notice of the new requirements along with those mailings. And then the inspectors will have that information when they go to perform their inspections. So depending on the risk level of the establishment, some establishments get inspected 3 times a year, some twice a year, and some once a year. So we are able to meet those requirements for that number of inspections. Our staff just work really hard at making sure that we are up to date with the current inspections.
Okay, thank you very much.
Thank you,
And
Alderman.
could you put me as, I'm sorry, could you put me as a co-sponsor on that, please?
Absolutely. Thank you, Alderwoman.
welcome.
And last I see Alderman Gunther. Are there any other members of the board who are not members of the committee who'd like to ask a question?
Thanks, Chairwoman. I don't really have any questions. I really support what you're doing here, and also want to ask to be added as a co-sponsor.
Thank you, Alderman. Okay, and with that, I think I will entertain Janine. I'll wrap this up and say again, thank you for your efforts and your service as always in our health department. I see Dr. Eccles here as well. Thank you so much for the work of the health department on this bill. I think it's a real testament to our health department that so many of our members of the board are speaking so highly and so willing to jump on as co-sponsors of a bill that's led by our health department. With that, I will entertain a motion to pass Board Bill 207 with a due pass recommendation.
So moved.
Second,
Previous-
previous roll.
Hearing no objections to previous roll, Board Bill 207 has passed with a due pass recommendation. Thank you all. The second order of business today is to hear concerns related to health in our city's medium security institution and both of our institutions here, our jail facilities. I'd like to recognize and thank Commissioner Glass, as well as our Public Safety Director, Judge Jimmy Edwards, for being here, and Dr. Eccles as well, and members of the public, many of whom are joining us today. I think the way through this most efficiently would be for an update on some of the issues that were brought to us by members of the media, members of the public, related to drug use, fatality, and other things happening in our jail facilities, as well as COVID. And so I'd like to ask for an update, and maybe we can hear from the two members of the public that identified themselves as wanting to speak, and then maybe ask for, we could turn it back over if there were issues that could be addressed by you all at that time. I will defer to Director Edwards if you would like to speak first, if you'd like to ask Commissioner Glass to speak.
Good morning, Alderman. My name is Jimmy Edwards. I am the Director of Public Safety for the City of St. Louis. Alderwoman Spencer, on last Friday, January 8th, you requested that Dale Glass, Commissioner of Corrections, and I appear here today to address two questions. Thank you for your invitation. First, you requested information about overdoses in the City Justice Center, and particularly about a specific case. On January the 11th, I informed you that you could not, or we would not, discuss specific cases that are in litigation. Nonetheless, with respect to your first request, we will discuss the structure of the jail and how folk attempt to introduce contraband into our correction facilities. Secondly, at your request, we will discuss COVID-19 inside of the City Justice Center and the medium security institution. At this time, I will turn it over to Commissioner Glass to briefly respond to your two questions. Commissioner.
Commissioner Glass, unfortunately, you're muted. Let's see if I can help out here.
Can you hear me?
Yes, we can.
Thank you. I appreciate that. Again, my name is Dale Glass, Commissioner for the Division of Corrections. The first topic that Judge Edwards asked me to address, and I'll be brief, is the makeup of the building. I think the only reason, I think that's significant just to understand that a lot of people don't understand that the whole building is not the jail. The jail is third, fourth, and fifth floor. I share this building with the sheriffs and the police and city marshals. However, just so I'm clear, my medical staff do take responsibility for the medical care of everyone that's in the building, even though they are not in my custody. On average, at any given point, we have 70 to another 100 people in this building that are not under the jurisdiction or control of the Division of Corrections. So I think that's worth pointing out. In reference to how drugs can enter a facility, we're no different than any other institution across the country, whether it be jail or prisons. And I certainly don't want to educate anybody who doesn't know how to get drugs in on how to do that, but I'll make some general statements about the typical ways drugs enter the institution that are obvious. Contraband gets into a facility either by a detainee bringing it with them at the time of their arrest. Contraband can enter by either an employee, a visitor, a contract person bringing it in. And also contraband infiltrates our mail. I can say also that during COVID, what's interesting about jails that people don't really, perhaps don't know, is that it mirrors the community. Whatever is going on in the community goes on in the jails. When there's an increase of drugs in the community, there's an increase of drugs in the jail. Quite frequently, the reason people end up in jail is related to those behaviors. So a lot of people come to us well entrenched in their abuse of drugs and the impact and effect that those drugs have on them. What we've seen during COVID is an increase in drugs, increase in people trying to get drugs in, even though there's no visits. And what's going on in the community is an increase in K2. And even as those formulas change and all those things occur, the same things occur here. So that's what's going on. That's what we see. And my medical staff, my correctional staff, have been trained to detect and try to intervene on those. And quite frankly, they have probably save countless people's lives. Unfortunately, we're not always successful, and sometimes they're too far gone for us to even help them. So that's my general statement about drugs in the facilities. And as the judge indicated, I don't have anything to say regarding a particular case, but those are general information that's true across the country. And, oh, I'm sorry.
Go ahead, Commissioner.
And I don't know, did you want me to comment about COVID as well, Judge?
Yes, please. Go ahead and give an overview of COVID. You might share the numbers as well as kind of the timeline with respect to how COVID was visited upon our jails.
Yes. And Dr. Eccles is here, and I'm glad because throughout this process and the actions that we've taken in trying to comply with CDC, he has been quite helpful, and we always let him know what we have in mind and what we're doing and get his feedback and default to his suggestions and our directions. We actually started trying to put in place a plan to address COVID in February. We have been tracking what was going across the country and looking at various things that people were reporting, particularly on the West Coast, and what they were experiencing. But to also interject is that every year toward the fall season, flu season, we have some of the same precautions that we take every year already in place. And we were well into that issue. And I saw outbreaks on the West Coast of flu and rising significantly. So I met with my staff and talked about what are we doing so far about flu? There's conversation about this COVID. Let's move forward off of that and develop a plan and go forward. And medical had already started taking temperatures back in February and doing those kind of things when people enter the facility. We were already in our process of wiping down common areas. So we moved on that. And I think that we had some success. Our first positive case of COVID-19 in this division was on June the 17th. So we were without any cases until that point. It's interesting to me because that kind of coincides with what we saw happening in the community in terms of our first opportunity or the communities relaxing some of the restrictions. So we saw COVID first introduced June the 17th. During that particular surge or phase, the most we had at one time, I think, was 20-something people. That's for the division. And also during that first phase, the total we had was right around 45, 48 people total, not at one time, but total. And then around October the 22nd, we had 0 cases. We went back to 0. We continued all those things we had in place. We did our isolation. We added to our daily, more than daily, wipe down of common areas and living spaces. We added a contract with an outside provider to spray all common areas in the entire buildings every other week, and we still have that contract in place. We also took advantage of the numbers during that time started to drop in terms of population. And one of the suggestions that came through CDC was that jails should try and isolate people for 14 days before introducing them into their general population. Mm-hmm. When the numbers are high, it was impossible to do. And I think that after this is done and we review different things, we'll find that the people that were able to isolate fared better than those that were not. That probably just makes sense. MSI played a significant role in helping us to be able to do that. And we still isolate people for 14 days prior to introducing them to the general population. So on around October the 22nd, we went to 0 and had no cases. And we remained like that until our second surge, which was around December the 15th. Again, that date kind of coincides with other restrictions that happened in the community. And so then we saw ourselves starting to see cases. Right now we're at 30. We've had altogether probably about 50 cases over this second surge. And today we're at 30, as I indicated. So we know that we continue to put in place the same guidelines about wiping down things, protections, PPE. We've got plenty of PPE. The city has provided us everything we've asked for. We changed what was available based on what was going on at the time. We've had no problem with that. We do get pushback from our detainees because they don't want to be in compliance. They're generally tired of restrictions, and they just want things to be normal, even though one might view a jail as being restrictive, and it is, but they hold more dearly the little things that, you know, they are able to do. And some of them are just bad actors and don't want to comply with those rules. So I think, I'm sure there's maybe questions, but that's kind of an overview of what we have.
Hey, Dale, before we take questions, let me just add, if I may, Madam Chairman, that prior to us having to move 25 of our COVID positive people down to MSI, we had only had 12 people to have tested positive for COVID at MSI over the entire 10-month period. And so we were able to manage MSI much better than CJC because every person at MSI was in a single person cell. Also, I might add that we've had no one to have to be hospitalized as a result of COVID-19 over the entire period. We've had most of the folk that tested positive as a result of us doing a testing of the facility, wherein most of the people were asymptomatic. We've had 5 people that have had low-grade fevers that we have monitored very closely. So with respect to COVID and the correction facilities, we're probably at a total over the entire period at about 85 people that have been exposed to or have tested positive for COVID, and that's in both facilities combined. So we're ready and willing to address anything that you have or any questions that you might have at this time, Madam Chairperson.
Thank you, Director. So if I'm understanding correctly, there are 30 patients, 30 people currently tested. Can you help us understand when and how that, how many have been tested so far? Or you mentioned that you're doing proactive testing, or how and when are folks being tested, and how many of our detainees are tested on a regular basis, just to help us kind of understand what.
Dale, how many did we test when we did the?
Well, I'm sorry, I don't know off the top of my head how many we have tested throughout this process. We mirrored what was happening and recommended as COVID, and we learned more, and CDC revised its recommendations along with the health department. But initially we started off with testing people that had symptoms. And then we would expand it based on our ability to trace where that individual may have been, who they may have had contact with. For example, an obvious person would have been if they shared a room with someone. And then if those results indicated that that number was larger, we'd expand it out. And that's where we began. Then when the test became more available, we offered the test to any and everyone, and several decided they wanted to take it, many refused. And so we gave them that option, obviously, to be tested or not be tested. And today, the same thing holds true. Anybody can be tested at any time if they choose to be tested. If there are any positive, then we do our tracing kind of thing and expand based on what our findings are. So I don't have a number, but the judge is right. This whole time, there's only been 5 that have actually had muscle aches or a fever, and everybody else has been asymptomatic. A couple of people reported they couldn't taste their food. We tested them, tested their cells, and that issue was our second surge around in the middle of December, and it spread out where we actually went to all the units and said, hey, we got a couple more cases. We're here to test you. We can test you right now. Who wants to be tested? And then, of course, then we expand where we thought it was necessary. But I don't have, I'm sorry, the total number of people that have been tested.
And Commissioner, when a person wants to be tested, are they tested immediately or
Yes.
that same day?
Yes, immediately. And quite frankly, what we often do is we go to them and say, hey, we had a couple of tests positive. We are here. We have the ability to test you right now. Who wants to test? Come on up. And if they ask us, then we test them immediately, even if we're not doing that.
Okay, Commissioner, thank you so much for being here and for, kind of helping us understand a little bit on the front end. I'd like to turn it over to a couple of members of the public that had some concerns that brought them to us to hear from them, and then I'll turn it over to the committee for questions. First, we have, let's see, Ms. Inez Bordeaux from Arch City Defenders. Inez, are you on?
Yes, I'm right here.
Okay, I'd like to turn it over to you to testify before the Health and Human Services Committee. As I said on the front end, we're going to try to keep, I'd like to have everybody have the ability to air concerns, but I'd like to make sure that we get through this. And there's only two speakers, Inez, but I had stated if you could maybe keep it within 5 minutes. If you need more time, please let us know.
Okay, I think I will talk fast and 5 minutes should work. Thank you very much, Alderwoman Spencer, for convening this meeting. My name is Inez Bordeaux. I am the manager of community collaborations at Arch City Defenders. I am also an organizer with the Close the Workhouse campaign. I am a mother of 4. I'm a resident of the 9th Ward. I've also been a nurse in Missouri for 15 years. And before that, I was a CNA and a medical assistant. So I've spent almost the entirety of my adult life in healthcare. And I am very concerned. The Close the Workhouse campaign has been asking what the city plan was to keep COVID from running rampant inside of the jails since the very beginning of COVID, almost a year ago. And as far as I can tell, the city has never released a plan publicly for what their plans were. I believe that as a society, as a city, as human beings, we are judged by how we treat the least among us. That means the poor, that means marginalized groups, that means the unhoused community, and that also includes people being detained inside of jails. And I personally, in the last week and a half, have spoken to 15 people that are currently being detained inside of both CJC and the Workhouse. And it seems to me that based on the conversations that I've had with the 15 individuals, that Dale Glass and Jimmy Edwards are not telling the truth about what is happening inside of our city jails. Based on just the 15 people I have spoken to, Arch City Defenders has a jail info line that is toll-free, that people inside of the jails can call us 24 hours a day, 7 days a week to express their concerns. And after the events of December 29th, we received an influx of calls. For every one call, for every one person that I spoke to, there were 3 calls that I missed. Someone trying to reach out and explain to us the hellish, unconstitutional, inhumane conditions that they are being forced to live in inside of both CJC and the Workhouse due to this COVID outbreak. And those 15 individuals that I spoke with, every single one of them tested positive for COVID. Every single one of them said that they were not receiving adequate medical care. Nurses weren't checking on them. They weren't getting their medications. They weren't getting their vital signs checked. People are telling us that that there is no social distancing, that they do not have access to cleaning supplies. They don't have access to PPE. They don't have access to the medical care that even as people being detained in jails still deserve. They still deserve to be treated as human beings. So after speaking to those 15 people, and I know it was 15, I went back and checked my notes this morning, we are failing. And by we, I mean city officials who are in charge of making sure that the least among us, the most vulnerable among us, are protected from a respiratory disease that can be a life sentence, it can be a death sentence, and the lifelong effects that people who have tested positive for COVID could likely have, everything from heart conditions to brain conditions to respiratory conditions. These are what the people inside of the jail are living with. And it's abundantly clear that the city officials are failing those people being detained. They do not have access to everything that Dale and Jimmy says that they have access to. Half of them have been requesting testing and haven't been able to get it. The other half that have been tested have had to wait weeks upon weeks to get those results. There are people who have been tested for COVID who still do not have the results of their tests, and it has been over a month. They have complained that the nursing staff is withholding that information. There was two separate individuals who reported to us that the nursing staff told them when they were being quarantined inside of pods with a mix of people who are COVID positive and COVID negative, that it doesn't matter because you're all contaminated anyway. This is how we're treating people inside of the jails. And something that my mom used to say is, are you going to believe me or are you going to believe your lying eyes? And in this case, lying ears. So if it comes down to having to believe Dale Glass and Jimmy Edwards about what is happening inside of the jail, I do not believe them. I do believe the dozens of people. I'm going to repeat that one more time. Dozens of people. We have spoken to over 40 people inside of these jails just in the last week, not in the last month, just in the last week, who categorically deny the precautions that our city officials are saying are in place. And we just really have to do better. But we cannot do better until Dale Glass and Jimmy Edwards can at least admit the truth about what is going on inside of the jails. It was released publicly that there was initially a disturbance inside of the jail, and people were transferred because there was a riot, they were transferred because there were fights going on between inmates, and every single person that we have spoken to has categorically denied that. Every single person. The reason people were transferred out of Pod 4C that the city has been treating as a dumping ground for people who are positive or may be positive for COVID is because these same people being detained have been demanding access to cleaning supplies and PPE and their medications and the tablet chargers being fixed so that they can communicate with their families. This is what they were complaining about, and they were told time and time again by the superintendent of jails, I believe his name is Adrian Barnes, that these issues would be addressed, and they never were. And instead of those issues being addressed, the nursing staff, the jail staff left the last meeting and sent in sheriff's departments where these people who were suffering from a respiratory illness, a respiratory virus, were then maced. and told to lay on the ground in standing water and zip tied and then transferred to the workhouse, which we all know is infested with mold and asbestos, and there's no heat and there's no air conditioning. There's not proper cleaning. So once again, the city is failing the people inside of these jails. And I demand that our elected officials do better. And I demand that our elected officials stop sitting in our face and lying to us like we don't have access to people on the inside, like we don't have access to their public defenders and their defense attorneys who are telling us what is truly going on inside of these jails. So before we can get anywhere, before we can do better, before we can put the proper precautions and safety precautions in place, we at least need the city to tell us the truth. And the fact that we're sitting inside of this committee meeting and having to listen to things that we know are not true is unconscionable. And the longer I sit here and think about it, the angrier I get. I am a nurse and I understand very clearly what the risk factors are. And I am also a person that has spent time inside of CJC. I'm a person that has spent time, real time, inside of MSI. And even in the best of circumstances, even in the best of times, I know that there is no heat inside of the workhouse, that there is mold, black mold growing on the walls, and that the food is not fit for people to eat. And those are in the best circumstances. In the best circumstances, people are not getting access to the medical care that they deserve. And that's something that not only that they deserve, but that is required when you are infected with COVID. In the best of times, those things don't happen. So I know now in the worst of times that they aren't happening. And the fact that we're sitting here and being lied to by our by appointed city officials is infuriating. Thank you, Alderwoman Spencer, for giving me an opportunity to speak. I really appreciate it. And again, I demand that we be told the truth. And that's all I have.
Excuse me, I was muted there. Thank you, Ms. Bordeaux, for coming today and sharing your thoughts and your concerns with the committee. I'd like now to turn it over to Noelle Pfeffer, who is also with Arch City Defenders and has shared some thoughts previously with the committee. Noelle, Mr. Pfeffer, you're up.
Thank you. Good morning. My name is Noelle Pfeffer. I'm a resident of the 6th Ward and a Justice Catalyst Fellow at Arch City Defenders. Thank you for calling this hearing to inquire into health conditions at city jails. The people of St. Louis deserve to know the truth about COVID outbreaks at CJC and the Workhouse. And as Inez explained, over the past 2 weeks, Arch City staff has been collecting reports regarding COVID in city jails from detainees, their loved ones, and their legal representatives. I'm dedicating my testimony to sharing these accounts, which shed light on recent reports of protests at CJC and describe an atmosphere of fear and suffering within city jails. And I'll let you draw your own conclusions. As one detainee put it, seems like they wanted people to get sick. There was only about 8 people sick in my pod, and they just started bringing in more people without testing them first. Next thing you know, everybody was sick. We weren't rioting, we were protesting because they weren't protecting us from COVID. The food was really bad. We didn't have cleaning supplies and they were treating us like animals. We had several meetings, several petitions, but the staff wasn't listening. Other accounts match up, explaining that there's no social distancing, no masks, no cleaning supplies, and they're giving us leftover food every day. Another report explains that they never check the vitals or temperatures of those in the pod at CJC, even though many are asthmatic. Multiple inmates are being forced to cohabitate with individuals displaying symptoms of COVID, and they told us that they begged to get out of the pod, but were ignored. It's clear that the city jails have failed to practice basic social distancing and hygienic protocols. For example, one detainee was forced to enter a cell that he was being transferred into after a person sick with COVID had been transferred out without any cleaning of the cell. The lieutenant threatened to mace him if he didn't comply. Yet another explained that staff won't even let them wipe down the phones between use, and that he had to put a sock over the phone just to make the call. These were all factors driving the protest, which was preceded by multiple petitions for redress. But despite an initial discussion with Commissioner Glass and the superintendent of the CJC, the protest was met with overwhelming force from correctional officers and sheriff's deputies, who cut off exhaust fans and sprayed mace into the pod. Again, this is a pod full of individuals suffering from COVID. In the words of one detainee, they launched Mason. There were people coughing, people throwing up. Then the sheriff's department came in with masks and nightsticks, telling everyone to get on the ground. They hogtied people, and some were bleeding, forcing them to lay in puddles of water. Another detainee told us that he was beaten and now can't see out of his left eye. Another reported that upon his transfer to the workhouse, he spent 7 to 8 hours without any bedding, in his cell, wet and cold. He's now feeling sick and racked with cold sweats and shivers. The people of St. Louis deserve to see footage of these and other incidents. We have filed a sunshine request for them, and we urge you to join us in requesting all video and audio recordings collected by surveillance or other cameras at the City Justice Center or Workhouse between Tuesday, December 29th and the present day, which show footage of hostile interactions between inmates and correctional officers or sheriff's deputies. Additionally, we urge you to request access to all complaints, petitions, or grievance forms filed by inmates of the City Justice Center or Workhouse between October 1st and the present day. Finally, another fact that stands out from these accounts is that, despite the city's claims to the contrary, the workhouse's chronic problems, including freezing temperatures, leaks, mold, pests, and inadequate plumbing, remain unabated. According to detainees, the workhouse is leaking. There are cracks in windows and walls, and the showers reek of mold. Laundry is only done once every 3 weeks, and they only hand out masks once a month. Another detainee tells us that few of the toilets work, so detainees have to enter other cells, possibly risking COVID, just to go to the bathroom. Other accounts report that the workhouse is basically a freezer. There's no insulation in the cells. The blanket is just a sheet. There are roaches, mice, and other pests in the pods. The walls are leaking. There's mold everywhere. They are freezing. They can't sleep for more than 10 minutes at a time. These inhumane conditions are compounded by inhumane and negligent treatment. Guards regularly mace detainees while they're locked in their cells, leaving them in their cells for extended periods of time as a form of punishment before allowing them to rinse. This over-reliance on mace also forces detainees to cough and take off their masks, which only increases exposure for everyone in the pods. Another detainee shared that he was hit on the head with a baton and tased by correctional officers and hasn't received medical attention since. Multiple inmates transferred to the workhouse in soaked clothes shared that it took nearly a week to get a change of clothes and underwear. Of course, it's worth bearing in mind that most of these folks have not been convicted of any crime. Innocent until proven guilty, they are awaiting trial with an average length of stay of more than 300 days. It's no surprise, though, that at least one detainee has considered taking a guilty plea just to potentially get out sooner. He doesn't want to die. Detainees deserve better. Our city deserves better. Thank you for shining a spotlight on this critical issue. And I would specifically urge you, following up on Commissioner Glass and Director Jimmy Edwards' testimony, to really get those hard numbers on how many individuals have been tested. How long does it take between testing and receiving those results? And finally, requesting those grievances so that we get the full picture, not just the official story. Thank you.
Thank you, Noel. I thank you both for sharing your concerns with the committee and sharing your concerns with us in a general sense as we move through this. I'd like to turn it over to the committee to ask questions, and I'll start with our roll call in order here. Alderwoman Ingracia.
Thank you, Madam Chairwoman. Thanks to everybody who's made time today to come and speak to us. I think many of our colleagues, including myself, have been contacted via email from families of concerned inmates. I've also been contacted by a number of public defense attorneys who are also receiving maybe the same or similar complaints or concerns. And so there has to be something happening here, right? Like I value the relationship I have with you, Mr. Glass. You always take my calls, you're always responsive, but between the testimony that you're providing and that Judge Edwards is providing and what we're hearing on the ground is so far apart. I'm having trouble even forming a question. I apologize. I guess the first question I have for Judge Edwards is, It seems like there's been a sunshine request for some information. Is that something that we could request as the health committee to also receive? And I would think the sooner the better to help sort of find out what's actually happening or has happened. Is that a possibility, Judge Edwards?
We have a sunshine request coordinator. I never see the sunshine request, so they go to the coordinator. But let me just say, I appreciate.
Hold on, just for one moment. I mean, that's not the question I asked. The question I asked is, as aldermen of sitting on this Health and Human Services Committee, are we able to request that information, or are you going to require us to submit a sunshine request for that?
No, I'm not going to require you to submit a sunshine request. I mean, if you ask for information, we try to provide the information to you. So that has never been my practice to require any alderman to submit a sunshine request. So you will get the information that we're able to provide to you lawfully. But the point that I want to make, first of all, I appreciate the two people talking.
Sir,
I'm sorry.
I apologize. I'm the one that's asking questions right now.
Well, I'm trying to answer your question, Madam Alderwoman.
The question I asked was about the information that we would like to have possibly via the health department or the health committee, if that's okay with the chairwoman. And I don't have any other questions at this time.
Alderwoman, if you wouldn't mind preparing those questions and then sharing them with the committee and the judge, I think that would be the best way to proceed through that. Thank you for your efforts on that.
Yep, will do. Thank you, Chairwoman.
Alderwoman Tyus. You're muted, Alderwoman Tyus. I'm glad you're here.
Good morning.
Morning.
First of all, I just want to speak to the Alderwoman from the 6th inquiry about getting information. There are 4 of us who are committee chairs. The charter requires each and every department and everything else, anybody else in the city of St. Louis who has any kind of information that we want to give it to us per us being a chair, because we have the same rights as the mayor and the comptroller to any information. So you do not have to ask, you do not have to wait for the chair of this committee. You are a chair. Alderwoman Green is a chair, and I am a chair. And I often make people give me. I don't ask, I demand. And if they don't give it to me, we actually can bring a suit against them because they are required to. They cannot give anything to the mayor or the comptroller that they do not provide to the Board of Aldermen, and especially the chairs, because every committee has. And I will send, and I tell you guys all the time, learn the rules. I will send you the citation to the city charter. So when I get my information, I always send that along with them so that they don't have to run around saying, what do I do? And then I tell them to call the city councilor in case they don't believe me if they can't read the city charter. But we do have people who believe in violating the city charter. As I sit here and listen, I didn't hear Judge Edwards' testimony. I just came in on the end of Mr. Glass's testimony. But I did hear Ms. Bardot and Mr. Is it Pfeffer? I'm sorry.
Mr. Pfeffer. No, Pfeffer.
Pfeffer. So I'm kind of in a unique situation. Besides being an attorney, before I was racially gerrymandered, I was the chair of public safety, and many, many years ago started taking people. I was the person who started taking tours of the workhouse and took the press in there back in 2001, and just found out so much that they would say was not true. I knew kind of from being a public defender and my days as going out to the workhouse, but when I got to actually take tours through the workhouse, it still is hard for me to think about. My latest experience with the workhouse is that a few months ago, you guys heard me talk about, I had a tenant who has been a long-term tenant of mine who was falsely accused, and now all his stuff has been eradicated and they cleared all the charges. But he went in jail in January on Martin Luther King's birthday. And only because I started raising so much hell in April and started writing letters to the judges, because they just kept holding him over, and they wouldn't give him a bond hearing. And I wrote to the Supreme Court. I wrote to Judge Draper, who I used to, when I was a public defender, he was a circuit attorney, and he is now Supreme Court justice. And so I wrote to him. I went and I wrote to the judges about how they were violating the law and the things that they were supposed to do, and how could this person continue to be held over and not be given a bond. And when I did that, the judges who had been on the cases started to disqualify themselves. All of a sudden, nobody wanted, and I started calling, and my name came up. So my tenant ended up getting out of jail. I actually paid his money, which I have never done, but I knew he didn't do that. I actually paid my own money to get him out of jail and dealt with his public defender. And they finally gave him a bond of $500, which I gave to him, because that's how much I knew that this was not true. Then it took another 3, 4, 5 months. Finally, they threw his whole case out of, they threw it out of court. But what he did, what you are saying now is what he told me then. Didn't have anything and didn't know anything about that this was going to be a hearing. But everything you're talking about now, these are the things that he told me. So I absolutely believe both of you all that that's the truth. I don't know what Judge Edwards says. He's again, so let me say, he's a personal friend of mine and my constituents. But I do know that there was no reason for my tenant to tell me all of that, except for that it was the truth, because he was out. He got vindicated. He's working now. Lucky for me, we were able to get his job back, but they held him there. And he had other children on a false charge, and he tells me about the things that's going on in the workhouse. And I believe him. I also don't believe that we're doing COVID correctly, because Dr. Eccles has had a reckless disregard for the 63115 zip code. You all know famously that I brought Dr. Eccles before me because he was cavalier and disregarding about, now I'm not talking about people who are locked up. I'm talking about my citizens out here who pay the taxes for his salary. Still has not done anything, and really owes that I didn't continue it for somebody on this. The person knows who called me to make me stop, but I can't believe that you're treating the prisoners better than you treat the residents in the first ward, because you definitely are disregarding of them. So I guess the first I just want to say, I believe you. I do not believe that they're treating people right. But I guess my question would be to Mr. Pfeiffer, and I'm sorry, when you get on, please say how I should say your name. I want to know what is your suggestions of what could be done to make sure that the things that you think that should happen are done? So is your suggestion to let more people out? Is your suggestion, I know we're supposed to be closing the workhouse and that's not going on, but I want to hear what you suggest of how we can address it. I was the last person to come on board of closing the workhouse, and I still am not the same place that everybody else is, because I was the chair of public safety when we built the Justice Center, and we did not build that for a long-term holding facility, okay? And so I know also when I was a public defender that the people used to hate when they have to come from wherever they were in jail and come to the workhouse, or at that time city jails, because they didn't have the same privileges. So I know that the Justice Center is not built for long-term detainees. So what is your suggestion of how we can make sure that the prisoners are treated right? And I also know all about how cold it is. It's been like that for 30 years. So all these things that you're saying, we said as public defenders back in I started as a public defender in 89. So you're not saying anything we didn't say, except for we didn't deal with COVID then. So what is your suggestions of what we can do to improve these things, and how we can make sure that what they're saying they're doing, that they're actually doing?
Thank you, Alderwoman, for your question and for your deep engagement on these issues for decades. I don't necessarily think it is my place to offer the city's COVID response strategy. I actually think my first recommendation would be transparency, so that we can have a robust public conversation about it. However, one piece that I would highlight is that one surprising development recently has been an increase in the fraction of individuals who are held with no bond. And especially given the dangers of COVID and the fact that these individuals are being detained pre-trial into what could prove to be a death sentence, it seems to me that we should expect the opposite and demand the opposite. And that is to say, provide bail, allow people to go home where they can shelter in place. So that would be the big recommendation that I would offer. But the more fundamental piece is really about transparency, sharing the grievances, sharing the testing numbers, telling us how long it's taking to get people their test results. Thank you for your question.
Okay, so the Supreme Court, I guess a year and a half ago or 2 years ago, issued a directive to the St. Louis City Courts about bail, okay, which is why I wrote to the Supreme Court Justice Draper about how the judges were not following that directive. Actually, the former Supreme Court Justice actually made a speech at one of the Bar Association meetings about the injustice of what was going on with bail in the city of St. Louis, made a speech and talked about it. And I can share that with you. I can even share the letter that I wrote to the judges saying, hey, you guys are violating this. And so I can't say all of this is on the city. I have to say the judges are doing a poor job of having hearings and the people are setting bail. So all of this cannot be the city. You have to talk about the courts too. They're violating people's rights. Okay. So I cannot say Mr. Glass, Judge Edwards is all at fault for that. Okay. So what do we do about the judges? And I know you're not in charge of this, but sometimes when people criticizing, which I often do, then I also have to come up with what I think are better ways to do it. So that's why I'm asking you that.
Yeah, again, I don't necessarily know the answer to that question, except for that we need to have that public conversation, which is why I'm so glad that this hearing is getting underway. But I think you're right. It is a systems-wide failure. It is not just the city. And we do have to talk about the judges as well. And so I agree with you.
Okay. Madam Chair, can I ask questions of Mrs. Bordeaux? Ms. Bordeaux?
Yes.
Okay. Good morning. How are you?
Hi, Alderwoman Tyus. How are you?
I'm fine. So I heard you're a nurse by trade. Is that what you said?
Yes, ma'am. I've been a nurse for 15 years. And before that, I was a medical assistant for 2 years. And before that, I was a CNA for 5 years.
Okay. So I was out in my ward. We got a lot of things going on. So I was at a meeting. So I missed part of this meeting because I was out in the neighborhood. But I'm not familiar. Can you bring me up to date? Did you say something happened? I got 2 different dates, September 29th, and then I got November 29th. When was there a quote unquote riot or action that happened in the workhouse as you know it?
It was December 29th. There was a meeting between the people being detained inside of Pod 4C, which jail officials have been treating kind of as the COVID pod. And there had been ongoing conversations between the people being detained in that pod and the superintendent of the jail about their concerns. So there were more than 5 meetings over the course of the last 5 to 6 months. There were multiple grievances written, multiple petitions, and the people being detained inside of the jail just kept trying to get access to the things that they needed, namely masks, cleaning supplies, being able to social distance, and getting medical care. They also had a lot of concerns about the food that they were being given. They told us that they were being given the same food every day, like leftover food every day. And then what we were told is on December 29th, there was another meeting between the people being detained inside of that pod and the superintendent of jails. There was a lot of back and forth between them because many of the promises that the jail staff and the superintendent of jails had been making to the people detained inside of that pod were not being honored, broken promise after broken promise. And so on December 29th, after that meeting, when talks broke down, they began to peacefully protest. And after peacefully protesting, refusing to go back into their cells and protest, all of the staff, including the superintendent of the jail, all of the director of nursing that was brought in to speak to the people inside of the pod, and other staff left the pod. And a few minutes later, the sheriff's department returned with mace and batons and zip ties. They turned off the exhaust fans and they sprayed mace into the air. I just want to repeat that again, Ms. Alderwoman Pyatt. In a pod full of people suffering from a respiratory virus, they maced them because they were peacefully protesting the hellhole conditions that they were being forced to live in. And then after they maced them and made them lie on the ground in puddles of water, they zip-tied them. And within an hour, they were all transferred to the workhouse, the worst place that you can transfer someone who is suffering with a respiratory illness because of the mold that we know is there, because of the asbestos that we know is there, and because of, you know, the cold. There's very little heat inside of the workhouse, and I know that for a fact because I spent 30 days inside of the workhouse, so I know how cold it is there. We were also told that after people were transferred to the workhouse, they were made to wait over 24 hours before they could take a shower to wash the mace off of their bodies. That many of them had to wait up to a week to get a change of clothes. Many of them didn't have access to even things like a blanket inside of the workhouse, which is cold. So again, this narrative that the city officials put out talking about there were riots and they were unruly and, you know, they were fighting each other and there were property damage. We know that none of that is true, that people were literally transferred to the workhouse because they were protesting, you know, their inhumane conditions. And I just cannot believe that this is happening and that we have city officials sitting right here on this call not telling us the truth. You all are the oversight body and they are sitting here and they are lying to your face. If we want to talk about, you said you believed what we were saying, and I believe it too. Everybody is not lying on them. Alderwoman Tyus, there's no way that the over 40 people that we've talked to, their family members, everybody is not lying. Everybody has the exact same story. Everyone isn't lying, and people are facing a death sentence inside of that jail. And if I could also address something that you asked Noel, we crunched the numbers. You know that Arch City Defenders partners with the Bail Project, and we also have lots of relationships with public defenders. And when we looked at the numbers of the people that are being arrested, 85% of them, our estimation, about 85% of them are being held with no bail. And that is on the judges. And it is a result of the lawsuit that Arch City Defenders filed against the city and the judges for unconstitutional bail practices. And when the Supreme Court handed down that ruling that the city had to change its bail practices, they did change their bail practices. They just started holding everyone with no bail is what has happened, which is why there are so many people still being detained inside of the jail. So now they went from holding people on bails that they could not afford, $25,000, $50,000, to just holding them with no bail at all. The Bail Project is more than willing to bail people out of jails. There is a Department of Supportive Reentry to give support to people who are coming out of the jail. We are placing them right into the care of people who specialize in supportive reentry services. And instead of that happening, judges are just saying, okay, well, we're just not going to give anybody bail. And that is why there are so many people being detained, not because there are more violent offenders, but just because judges are holding people with no bail.
So you said that the people that were in the pod were peacefully protesting. What is your definition of peacefully protesting, and what exactly were they doing?
The people that I have personally spoke to said that the people being detained inside of Pod 4C got hype. They were jumping around, making noises, banging on the doors, but there were no fights. There was no property damage. They were just hype. They were just hype, and they refused to go back into their cells, where they were sometimes bunking with people who were COVID positive when they were not, or they didn't have access to their test results.
Okay, and again, you said these were the people who had respiratory problems that they maced. Is that correct?
Yeah, the whole pod, just about everyone inside of Pod 4C was either already tested positive for COVID or they were exhibiting symptoms of COVID.
So, and I don't know if you know this or not, is there a policy at the Workhouse about how people such as the people in this pod should be treated? Is there, I know sometimes you do have to mace people, you have to tase people from the other side of it, but this particular group of people, is there or should there be a policy about people with respiratory disease and how you should handle them if they are getting out of hand, for lack of a better word at this time? What should have been done in your opinion?
Okay, let me start by saying I've been a nurse for 15 years and I have frequently worked with people who are combative, who can be violent at times, who do not always follow instructions. I have spent many, many months working in psych facilities and behavioral facilities. And not once in the entirety of my nursing career have I felt the need to mace someone or violently restrain someone because of their behavior. Let me start by saying that.
Well, let me stop you for a minute. You're a nurse, though. You wouldn't do that. But what you're telling me is people who were security officials maced them, not nurses. Is that correct?
Correct. Well, not me personally, Mace, but I've never been in a situation, or there was a situation where I had to call in security or the police or the sheriff's department to mace someone who is unruly. Now, should they have maced a pod full of people who have respiratory distress? Absolutely not.
Okay.
Were they peacefully protesting? Yes. Did they have a right to peacefully protest? Yes. In my opinion, the jail officials should have left them alone. If talks have broken down and people are peacefully protesting, all they're doing is making noise and jumping around, then leave the pod, lock the doors, give them an opportunity to calm down, and then restart the talks. But the last thing that should have been done was a pod full of people with respiratory distress be maced. Now, I am not a city official. I am not a security or a jail official, and I am staunchly abolitionist. So I admit that those things color how I see this, but people have a right to peacefully protest, even inside of jails. They weren't causing harm to themselves or others or staff. They should not have been maced.
Okay, so I don't know if I will say that inmates have a right to peacefully protest. I'm kind of pulled on that. I have varying opinions on that because a lot of the people in the workhouse have been accused and have not been found guilty of anything. So you want to have people to have their rights, but a facility that detains in jails, you don't get all the same rights that you have outside of a jail. So I have some varying opinions on that. I understand what your point is, and your point is correct. If they knew that those people had respiratory diseases, then they should have found a different way to deal with it. But I don't know if you let people continue to make noise and do things. I think that part of the being incarcerated, there's some discipline because you have so many people. So I might differ a little bit with that. I want to also say that I don't know Mr. Glass. I've known Jimmy Edwards for over 40-something years. I don't know him to be a liar. So I can't accept that your critique of him. What I can say is that He may have different information than you. He and I would go round and round at it as personal friends for a lot of time, but I don't know him to purposely put misinformation out there that as a public safety director, he might not always have the same information, or people sometimes tell you things that's not always true. But I don't think that he would purposely be putting misinformation out. I would hope Mr. Glass wouldn't either. And I would also say there is a balancing situation that I often have to deal with myself, because there are people who commit crimes. As a public defender, I wanted to set everybody free, and I still am that liberal person. But there are people who commit crimes, and there is the public who, if you go to a lot of meetings, there is the public out there that want them locked up, okay? That want to feel safe in their homes, that want to feel like that the system is not failing them, especially when we look at what happened last week. The system failed some people on Capitol Hill. So I'm not going to say that the Workhouse or public safety always gets it right, because I told you I pushed back. I went and got my tenant out of jail, and I could do that because I have political clout to do that, and because I'm a lawyer, and because I knew the law, and so people didn't want that to go public. But there is a balancing factor of the good of the inmates versus the good of the public at large. And so sometimes I think that we are we incarcerate too many people, and most certainly that thing of the judges just going, because my particular tenant, they like 3 times they set his bond hearing date, and then they didn't do it. And then they didn't do it. And only because I got involved. Everybody can't get a Sharon Tyus to get involved with them. And so that's not fair. The law is supposed to be fair and applied fairly. So a lot of what I'm hearing from you, not about the Workhouse situation, but the other part about the bond issue are the judges. And so that's the people, to me, that we need to bring before us and explain why they are in violation of laws, not having a speedy bond hearing and letting people, and setting a reasonable bond so that people can be released. Because even with my tenant, they set it for $500. Now, you've kept him locked up for months. It's a miracle. He didn't lose his job because I went and talked to his employer, and he was a good employee. He had other children that he had children out there that he is the sole provider for. So he could have lost his job. He could have been part of the system because the system failed him. And so I find that horrible. So I think that we need to be having a conversation with the judges also, not just the city officials.
Alderwoman, I'm going to interrupt.
I was done now.
Just right. Because we only have the judge and the commissioner until 1 o'clock, and I want to make sure.
Okay.
The committee.
I'm done anyway. Thank you.
But Alderwoman, if you would like to follow up, I think especially with Ms. Bordeaux on some of your thoughts and share them with the rest of the committee, I think it would be very helpful. I don't want to cut off the conversation. I just want to make sure that we get to everybody.
I was done.
Thank you.
I was done. Thank you. Mm-hmm.
I would love to talk with you about these things. I'm going to email you. Let's set up a time to talk. I would love to do that.
Right. I'd like Alderwoman Green, do you have any questions?
Yes, I do have one question, probably of Commissioner Glass. Just curious about what are the protocols for when it is decided that an agent like mace would be used? Like what is the triggering protocol for the use of an irritant like that?
Thank you, Alderwoman Green. So I have a lot of comments relative to what's said, but I'm just going to answer your questions. And if the opportunity presents itself, I will make a couple of comments. In direct response, my task is the safety of the staff that work there and the citizens that are confined there. My goal is to run a jail that is both safe, secure, and orderly. So I use the means necessary to accomplish that task. Paramount for me is to accomplish that task by treating people with dignity and respect. That is who I am. That's what I do. That has nothing to do with my employment. It's about who I am. And so I don't lie. I'd rather suffer punishment than lie. So anyway, I'll just stop there. But yes, so sometimes it is necessary. My intent as it relates to pepper spray and my staff is to protect themselves when there is a unpredicted or unforeseen emergency to do so.
And have there been, I guess, training amongst staff with regard to the possible implications of using something like mace or pepper spray on people who are COVID positive?
So part of our conversation and training as it relates to pepper spray deals with the health of the individuals and making those kind of considerations. Even sometimes knowing what those risks are, it still is necessary. But what is paramount is no matter what kind of force is necessary, we always have them immediately seen by medical. So to address that issue, and you know, I think that I'm answering specific questions, but they might be geared towards something that really I'm not prepared to discuss at this time as it relates to the disturbance. We continue reviewing and looking at those issues and to report any and all things, positive and negative, or whatever it looks like as it relates to us and what we did, will be available to the director and be made available to anybody on the committee. And Alderwoman Green and others, and I've spoken to you as well. Anytime you have a question for me, I answer it. I answer it directly. I don't filter it. Director Judge Edwards doesn't cause me to filter it. And even if he tried, it wouldn't work. And nobody in the administration does. So I feel comfortable in, you know, not knowing why a person's asking a question or what the purpose is, or the end goal. I answer the questions because I believe, and I know it to be true, the Alderwoman, the Alder people have a right to know what's going on. They work for the citizens. They are responsible. Even when it comes to touring the jail, many of you have been in that jail. Many of you, and you know what I've done with that jail. Even the circuit attorney, I took her to that jail and I said, look, you need to know who you're sending to jail and what that jail looks like. So I allowed her to, I gave her a tour, had her have a tour of that jail. And even she participated in some of the programs. I let her see what we were doing for the inmates and how we treat them. And so, you know, people can have their opinion and believe. I'm not disturbed by that, but I don't lie.
So I guess the next question I have, as you may know, I have been incredibly sick with COVID for most of December, and I still have a lot of lingering symptoms, and I still have days like yesterday where I find it somewhat difficult to function. This seems to be something that is happening with more COVID patients. And so I'm wondering, beyond even when folks just have their initial diagnosis and you're really sick for a couple of weeks, what is being done to tend toward COVID positive patients to ensure that folks' medical needs are being met? As you know, I personally discovered that those needs can be somewhat significant at times, and I cannot imagine having to go through this while also being confined to a space that does not give me the comforts that I needed to get through this.
Yeah, I appreciate that. So I'll answer it in this fashion. The first thing I would indicate to you is that we are nationally certified in the healthcare that we provide. MSI had a perfect score. CJC had a 98. And I would say further that, you'll interpret it the way you want. We've been very fortunate that people have been asymptomatic and not sick. No one's had to go to the hospital. The other thing is that our medical staff are here 24/7. We have partnerships with all the local hospitals. The people that are positive with COVID are seen 3 times a day, temperatures taken, and the like. In fact, we have all the standard things that are required by NCCHC as it relates to medical, but we've increased that during the COVID, where even people that aren't positive, we increased the number of rounds we do. Our medical staff just go door to door. How you doing today? What's going on? Even before a sick call is submitted. That's what we're doing.
And how often are folks within both facilities being tested for COVID? So
that question is strange to me. I explained when we test and how we test. So I don't deliberately try to test people over and over. They can be tested, however, anytime they want. And there was a question I didn't know the answer to earlier, and my staff got it for me, is approximately how many people have we tested thus far? And thus far, 694 people for COVID. And so how often? As often as it needs to be done, following the guidelines and the instructions that we've been given, as Dr. Eckel helped us understand what CDC is saying to us.
Okay. I asked that question because I know a number of, for example, like senior living centers have, weekly testing that they do for all of the folks that live there, just to make sure that even if somebody is asymptomatic, that it is caught early and that person can isolate and they can locate any kind of outbreak before it spreads. And so I do know that other types of environments that have people that are closely confined to each other have set up sort of regular testing regimens. And so that's what the impetus of my question was.
I understand. And we submitted our plan to Dr. Eccles, developed with our medical staff and all of their specialists in the field. And so that's how we come to be where we are. The one thing that might be, I don't know if it's unique, but is true, is that we don't force inmates to take tests. A lot of them do not want to. The issues that around COVID that we have in the jail are no different than the issues you have around COVID in the community. They're the same. In terms of us being a confined space, yes, that's the nature of jails. We are similar to what you might see in a nursing home, only larger. I think that if there's anything relevant that this committee would want to assist us in is understand that this population should receive vaccinations, both the staff and the detainees. We work with positive COVID patients, just like you do in a hospital. So if I would like to see anything occur of this conversation, that would be it. So.
Thank you. Those are all my questions for now.
Thank you.
Thank you, Alderwoman Green. Alderwoman Martin is still not with us. Alderwoman Navarro.
Thank you, Chairwoman Spencer, and thank you, Commissioner Glass and Judge Edwards for your time today. And I know we're getting short, so my questions are regarding these COVID protocols. So thank you for sticking with this. And I think I mean, I do think the situation in the jail is different than what most of us are experiencing. I mean, as you said, it's a confined space, but also I very much am in control of who's in my house. And even though, you know, my kids are going to school and they may be exposed to other people, I'm very much in control of whether they wear masks and whether they're washing their hands. And I know what the cleaning protocols are. So I think there is reason to have heightened you know, protocols and this space. And I appreciate you going over these. I think in regards to testing, part of what I'm hearing is, you know, people are tested upon request or if they're symptomatic. Based on what we know about transmission, based on what I mean, one, people are often positive without, you know, having any symptoms. And I can see where, you know, if someone is concerned about, you know, what the quarantine conditions are, they may not want to be tested. And so whether I'm that person not getting a test or I'm the person in the pod with the person who's refusing a test, that definitely increases risk of exposure and decreases our lack of awareness of how pervasive it is. Thank you for getting the number of people tested, because I do think that that number is important. I'm curious, when somebody, while no one's been hospitalized while they've been in one of the facilities, do we know is there any sort of tracing that goes on after that once someone is released? You know, do we know maybe they're being hospitalized 3 or 4 days later or a week later? Is there any sort of contact tracing going on once somebody leaves a facility so that we can be on the lookout and go back and trace anybody that they were in contact with?
I think that Dr. Eccles could best answer that question. You know, for me, they're citizens, whether they're detained at the moment or in the community. So everything that happens related to COVID, I mirror what is going on in the community. We do have those other safeguards in place because of our proximity, but I share everything with Dr. Eccles. Who's been positive, what happened, what we did. We look at our video, well, they had contact with this person and they weren't wearing their PPE when they were supposed to, with that staff or inmates. And so the true contact tracing still happens with the health department. We provide them as soon as we find out in whatever information we have. And yes, there's concern about people that refuse to wear a mask or people that don't want to be tested. There's and that also concern, I have to take into consideration safety of staff, safety of inmates. What happens if you try to make an inmate take a test? The dynamic is significant.
So I think with this committee has talked about contact tracing in the past as well. And I mean, I think a lot of us have had the experience where people have tested positive and they're not. I mean, I know the city's just kind of overwhelmed, but if we're relying on the health department following up, having the capacity to follow up and contact trace and then follow back up with, you know, MSI or CJC to say, hey, there was somebody who was in this pod last week and now they're positive. I guess I have some doubts about our ability to carry that out to the extent that I think would be most helpful. What in terms of once somebody does test positive and they're quarantined, can you tell us a little bit about what that looks like in terms of how often they're being checked up on? Or do they still have access to phone and Zoom? How often are things being cleaned? And like many of my colleagues, I'm hearing from family members. I'm also hearing from people who are through separate channels, through some of the other folks on here. I'm also getting a lot of calls and emails about this. So I'm hearing from people that their experiences are not what I think most of us would expect or what's been described on this call. So if you could go into a little bit more detail about when someone tests positive, what services are they receiving at that point, and what is the protocol that's followed?
So I guess I'll reiterate or restate that the obvious, we do what CDC had described. Also, that protocol is reviewed by Dr. Eccles. They're isolated. I think they have better opportunities than people that would be in their homes because they have medical 24/7, even though they're asymptomatic or whatever the case might be. They are seen a minimum of 3 times a day by medical, and more often if that need occurs. in terms of wiping things down and cleaning, that happens all day long. And I don't mind, saying, because I'm not trying to make every person that is detained a bad person. Some of them are, but some of them don't want to be follow these restrictions. Some do, and some of them go above and beyond wiping and cleaning than we ever required. I even had the occasion to contact the superintendent and say, I was just looking at the video, and this guy is scrubbing all the way up to the ceiling, to the floor. He's doing a lot more. Say something to him. Let's do something. And we've even awarded people for their diligence in doing those kinds of things. But some of them, they're not going to wear a mask. They won't. And we continue to say, hey, you're not going to get wrecked until you get your mask on. We have to do the same things that happen in the community. No difference, except their reaction is a lot more severe. The other thing is, and I try not to ramble, I want to make sure I hit all the points you said, but I'll just add this one thing, is that when we do the recreation and those kind of things, we follow the numbers that the community was indicating that people should be, like at one point, no more than 6, and then it was no more than 10, and don't go to the barbershop. All those things we put in place inside the jail.
So you're saying that, so if someone tests positive, they are seen 3 times a day by medical?
At
That's
least.
true of everyone, because I've definitely heard from folks well, and do they have to get themselves to the infirmary in order to take advantage of that, or is somebody actually coming to them?
No, seldom in the jail does a person get themselves to anywhere. Medical comes to them for those checks. If there's a need to go to medical, my staff take them to medical. And then if there's an emergency of some sort, medical responds, just like, call a code and we respond.
And are those folks, and I'm sorry, I'm just moving kind of quickly because I know we're running short on
Yeah,
time. My other colleagues have questions, but, and they have the same access to phone or video calls if they're on quarantine as if they're not on quarantine?
Well, that's a question I was going to answer and I forgot about it. They don't have Zoom. They do have phone calls, and because we social distance, we only allow so many to record at a time. They may not have access as they did before, because we don't limit the phone calls in a normal environment, normal situation prior to COVID. Anytime you want to, you walk up and make a phone call. But because we only release so many at a time, that might be hindered. The only thing that would prevent an individual to having ready access is their behavior and being disruptive in the jail. And I've even accommodated for that, where I have several phones that are on wheels and can be rolled up to their unit if it's not safe for them to come out because of their behaviors. But I think I answered your question.
Yeah, and are we providing PPE? Is everyone being given a mask and replacing that mask? Several times a week, I would think, if they're using disposable masks. So we have masks for every person who's detained. And all of this, you mentioned all the other people in the building. I don't know how, that's being controlled, but do we have sufficient PPE to be replacing it as necessary for everyone there?
Yes, the city has given us everything we needed. Even anybody that comes to the front door, we have masks there. You don't get past that point without having a mask. The inmates, I don't know what the routine is in terms of, I just don't remember off the top of my head how often we replace it. But our overarching rule is anytime an inmate asks to replace their mask, they get another mask.
Okay.
Because someone could get it dirty or wet or whatever. So anytime they want a mask, we've got plenty.
So the last question I have is another concern I've heard in terms of people who are being detained for immigration purposes. How long are they? Because my understanding is that ICE is not necessarily doing the same pickup that they've been doing in the past. So how have those procedures or waiting periods been affected by all this?
So, Alderwoman, maybe I should answer that question. We are not working with ICE for any reason whatsoever. We would not hold an individual for immigration. That is exclusively a federal issue. It's not a local state issue unless an immigrant has committed a state crime, a murder, or what have you. But we don't hold folk simply for immigration. We don't work with ICE. We don't do any of those types of things. In fact, I don't believe that we have anybody in any of our jails that's being held under the federal agreement for immigration. So we just have never had that ICE issue. I have never entered into a mutual consent agreement where we would hold folk for immigration purposes.
Okay, so there's nobody who's been accused who's waiting on an immigration hold at any of our facilities?
Not that I know of.
Okay, all right, well, thank you for your time. I appreciate it. I have no more questions, Chairwoman.
Thank you.
Thank you, Alderwoman. Alderwoman Middlebrook.
Thank you, Madam Chair. My questions have already been asked and my concerns have been addressed, so I'll just let you move on.
Thank you, Alderwoman. Alderwoman Rice.
Probably helps if I unmute. Thank you, Madam Chairwoman, and then thank you everyone for the questions and the testimony today. I have a number of questions. I also know that we are running short on time, and I'm above everything. I would hope that we can compile a list of questions and documents that this committee would like to request, and hope that Director Edwards, yourself, and Commissioner Glass would be able to make those records available to this committee after the hearing.
Absolutely, Alderwoman. And I think between Alderwoman and Gracia, her questions, your questions, we also have other members who are not on the committee who we could coordinate with, and that way we could communicate in one fell swoop to the commissioner and the judge and be able to organize that.
That would be great. Okay. If I could, if I can run through a few questions that hopefully have quick answers that have not been addressed yet. I know that family that visitors are not being allowed in right now to visit with detainees, and phone calls you're saying are being made available. Are there any video capabilities for folks who have been detained to see members of their family or friends in any way, shape, or form?
The answer to that question is no. We are working on, and it has been approved by ENA already, a contract that would provide tablets. It's very difficult to do things like Zoom. In jails and prisons, you just don't typically see internet access provided to the detainees.
Sure.
So it is a challenge, but phone calls and some tablets, but not really much to speak of at this point, where they do texting and things like that. Just some left over from a pilot project that we were doing.
Okay, I appreciate that.
Okay.
And then the total number of tests, you said that there had been 694 tests administered. Is that the total number for the year 2020, or is that up to date that have been administered, or is that COVID test of the detainees? So is that a total for the year that have been administered?
That's the total number during COVID.
Okay, so currently, if I'm looking at the website correctly, we have 868 detainees currently in the jails as of the website. So 694 tests. It seems that there would have been a whole lot more than just 694 folks who've been in and out of our jails since the beginning of COVID. Is there? I guess I'm looking at the way that, like I believe it was Alderwoman Green that pointed out, nursing homes, that type of thing, that have sort of routine testing that comes through. And because detainees are being held in such close quarters, is there a way to be more methodically testing detainees as they are either brought into the jails or have been in there a monthly sort of cycle, even, so that we're getting a really solid handle on folks who may even be asymptomatic?
The first thing I want to do is acknowledge your observation that 694 versus a population of 800 might be somewhat misleading, because it's really about how many people have come through the jail during the last 8 months. Again, the protocol and approach that we take has been reviewed and approved by the director of public health. I guess we can have that conversation and see if he thinks that we should do something differently.
Okay.
But I just don't know.
Okay.
I try to just follow those guidelines.
Okay, I appreciate that. So then pod 4C that keeps being referred to, that is in CJC or is that in MSI?
It's so, you're asking me to comment on what someone else meant.
No, I'm sorry. I'm sorry. What I'm trying to get to, let me rephrase. What I'm trying to get to is the location where COVID positive detainees are being held. So I guess my question is not what specifically that number is. That's not of use to me at the moment. But my question is, so folks who have tested positive or are showing symptoms for COVID, is that also where high risk detainees are being held, or do we have separate facilities where detainees who have health complications that may put them at a higher risk for serious illness are being held? Can you just speak to the space of where quarantine is happening or isolation is happening?
So we have isolation occurring in both jails. We have isolation in our medical department. We have isolation in what we call pre-admit for people just coming to jail. And then we also have some isolation at MSI. And I'll just briefly comment that MSI was part of our protocol and strategy in terms of being able to isolate people. Like I indicated, the jails that have done well have the ability to separate. And that was a key component of that ability.
Sure. Okay. And so speaking specifically at MSI, the pods that we're referring to, it's just for, physical understanding of what the layout of that looks like. It is a wing of the jail that then there are separate cells that folks who are tested positive or who are in isolation would be in single cells within that area, but also have some common space. Or could you speak to what that looks like?
So the way we have to isolate evolves over time based on what's going on in the jail. The MSI is distinctly two separate portions. There's the old portion that a lot of people refer to that was built in the mid 60s, which we don't use and nobody lives in that. There's the portion that was occupied, put in place that people refer to as pods in early to mid 90s. And there are 4 of those units. And we'll call them general population units, but sometimes the need changes what we need to do. So it's kind of a misnomer. It serves multi-purposes. And so there are some people in that area, as I indicated, that at one point tested positive, are no longer positive. So that is also true.
Okay.
I don't know if I answered it.
Okay. So, and just a question referring back to Alderwoman Navarro's question about masks. Are detainees being given surgical masks? Are they cloth masks? Are they N95s? What is the PPE that they're being issued?
So we issue just as a matter of course of being able to have a mask is the surgical mask. Sure. But if a person is positive, then we go to N95, both for the detainee and staff.
Staff. Okay, great. And then I guess I do have, well, what is, if you have this information, it would be great to know the temperature at MSI overnight in these cells. The Alderwoman Tyus referred to heat being a long time issue at MSI, and with the number of complaints that we're seeing come in about being cold, I'm curious what the overnight temperature is at MSI.
Alderman Rice, let me see if I can address that, and I'll ask Dell to give you the exact temperature. That issue arose about 2 weeks ago with respect to temperature. So I asked the director of BPS to hire or to have an independent person to go to MSI to check the temperature in the common areas, in the hallways, in each of the units. We learned that the temperature ranged from 73 degrees to 77 degrees in all of the areas at MSI. Dale, I'm not sure if you have the specific temperature for every unit, but we know for a fact that the temperature ranges from 73 to 77 degrees at MSI.
I'd add two things. We set the temperature at 75, and it ranges based on where you're at and that kind of thing. The other thing is that the equipment is new.
Okay.
Been replaced.
Okay, that's great.
And air conditioning, but the pod has always had air conditioning, but we've replaced those units as well.
Okay. Sorry, one more question back to something that maybe Director Eccles would be able to speak to. What phase are detainees supposed to be vaccinated under in our current vaccination schedule? Or Commissioner Glass, if you know the answer to that.
I can probably answer that question again. I worked with Dr. Eccles to make sure that our first responders have some priority with respect to being vaccinated. Originally, we were in 1B. Yesterday, the governor moved us up to 1A. And I made the request that at the time that the correction officials get vaccinated, that all of our detainees are also vaccinated. And so I am pushing very hard to make sure that the people that we're responsible for their care, custody, and we're responsible for their safety. So I've asked that the detainees receive vaccinations along with our correction workers.
Okay, and you're saying correction workers are in 1A?
I've asked that they be in 1A.
That they be.
And so that's something, of course, that we'll work with the pandemic task force. I think we're there. I mean,
Okay.
you know, the governor gave us a win yesterday by moving up EMS, police, and fire. I think we'll move up corrections and our detainees at the same time.
Okay, great. And then do either of you have an average of how long it is taking for testing results to come back for detainees in either facility, in MSI or CJC?
So I would indicate that, again, we mirror the community. There have been times when we get a turnaround in like 3 days, but then around holidays or for whatever reason, when there's a large number of tests, both in the community and or the facility, it has taken as many as 7 days.
Okay. So you're not using rapid testing in
No,
the
no, we are
facilities?
not.
Okay. Is it an outside, like, is it an Affinia or an outside contractor that's handling the test, or is that directly through the health department?
We use the same thing everybody does in the community.
Well, that's fair. There's just a few different organizations that do it. So
We only have 2 minutes left, and I really
Sorry. Okay. I'll hold the rest of my questions. We'll submit them in writing.
yeah, and then we can organize the rest of them. Just so, Alderman Todd, did you have questions? I wanted to give every member of the committee. I'm so sorry you only have a couple minutes left. Alderman.
Quickly, I will quickly make a statement that says that we need to start dealing with science, education, and accurate information, because that's what happened with last week with the incident at the Congress. Studies show that science and studies show that it's poverty and also racism is the reason for all of these people being in jail in the first place, but also we're not letting them out on bond, because why would a person? Sorry, I missed it. We're violating people's constitutional rights, because a bond is supposed to be.
Madam Chair, point of order. I apologize. I can't hear. There's maybe somebody needs to mute so you can hear Alderman Todd.
Okay, can you hear me now? I need to move this other computer, because for a minute I just put it away right quick, because I'm on another meeting too. I just moved this one and then go quickly. I'm gonna stay. Okay, sorry. Okay, thank you very much. Sorry for the inconvenience. Quickly, we have innocent, most of the people, or some of them are innocent until proven guilty according to the Constitution. And we need to treat them as such. And those who cannot pay excessive bonds, excessive for a person in poverty or who is homeless, probably doesn't have any money. So I think we should consider that so we can have more, treat people humane. The other question though is, are the inmates treated as innocent people since they're innocent until proven guilty? Hello?
I think this is a question maybe for Judge Edwards.
Yes. Alderman Todd, as you well know, I spent 25 years doing a lot of work in the city with respect to crimes. I believe wholeheartedly that people are innocent until proven guilty beyond a reasonable doubt, and that the burden of proof is always on the state. I think as the city, what I think we are somehow conflating is that the city is only the jailer. You know, the city has no authority to put people in jail, nor does it have authority or has authority to let people out of jail. And so those are two different things. You know, I mean, there are people that are locked up that I probably don't think should be locked up, but I don't have the authority to release those folk as the city. And so, and I think the conversation that Alderwoman Tyus amplified about the responsibilities here, I think that's well taken, and I really appreciate her discussion, and I appreciate her making it clear that judges have that responsibility. We are engaging in a very ministerial job here as the jailer. Our job is to take care of the folk, keep them safe, and get them to court, and then the judges make the other decisions.
Okay, so the judges actually make decisions about bond. Is that correct?
Yes.
Okay, the other question, last question is, are inmates getting a speedy trial? Does the judge make the decision about that?
Well, of course, you know, we have constitutional right to a speedy trial. That's the responsibility of the judges and the prosecutor.
Also, is it the judge's responsibility to make sure that people are shipped to prison quick as soon as to the penitentiary as soon as they're convicted, or as soon as possible?
Well, unfortunately, in the state of Missouri, there's not a lot of movement of people going very quickly to prison after they have been convicted of crimes because of COVID. But the responsibility lies with the sheriff's department once they have been convicted.
Has the state been paying its share of cost of the city keeping its prisoners?
No, we get about $22 a day as we house prisoners. It costs us about $90 to $97 a day to house prisoners.
Okay, I'm sorry. Go ahead.
And we get reimbursed $22 a day if the state has money in the coffers for detainees.
So we're saying, I'm just rounding off, about $25 a day on average we get, but they owe us $75. They owe us $75 approximately. I'm just using round numbers because I don't want to. But the main point is they're not paying the full cost of us keeping the prisoners. That's the main point.
Our cost is reimbursed by statute, and the amount is $22 a day.
$22. Can we change the statute to 100% so some of that money we're spending on administration of justice can be used for services in our wards?
Yeah, those are that's an issue and something that I would like to see done. I've certainly raised it with the with the legislative body. We have not been able to get any traction with respect to the raising or the reimbursement for inmate housing.
Okay, thank you very much. And I have to go to another meeting, and thank you so much.
Thank you, Alderman Todd. I want to thank you all for being here today. Commissioner Glass, Judge Edwards, thank you for being available, especially with this short notice to spend time answering our questions. Thank you for your willingness to answer further questions that the committee will compile as a result of this hearing. Thank you especially to the members of the public who brought concerns to us over the preceding weeks, months, and have spent time with us here today. We as public officials, both elected and appointed, have an incredibly important burden here and responsibility to make sure that we are protecting our most vulnerable residents. And hearing concerns from the public and from the committee is an important component of ensuring that we do that. So I want to thank everybody, including the committee members who were able to spend 2 hours with us today, for your thoughtful questions and our thoughtful approach to making sure that all questions are answered. Alderwoman Ingracia, Rice, Tyus, and others who continue to have questions, if we could coordinate those so that we can present them to the judge and the commissioner and organize it, I think that would be the best way to ensure that all of our questions are answered.
Thank you very much, Alderwoman Spencer, for the invitation. We appreciate it. We're always available. Thank you.
Thank you. We'll be following up. Have a good day. Bye.
Thank you.
And with that, I'd like to call the Health and Human Services Committee to an end.
Move to adjourn.
To adjourn. Motion. Hearing no objections, Health and Human Services adjourned.